All right, hi. I'm Quentin Robinson. I'll be arguing on the affirmative of medicinal cannabis being made legal. I'll start first by refuting their claim that the terminally ill who use it for its analgesic effects benefit more from other drugs. Ethan Rousseau, MD, Senior Medical Advisor at the Cannabinoid Research Institute, said in 2005 that the THC component of cannabis is a very effective analgesic, which is another word for painkiller, and that the CBD, or cannabidiol, which is another cannabinoid in marijuana, has unique immunomodulatory benefits as an antagonist of tumor necrosis factor alpha, supporting benefits in treatment of rheumatoid arthritis. And the ASA said in 2005 that cannabis has demonstrated ability to improve mobility and reduce morning stiffness and inflammation in patients with arthritis. Research has also shown that patients are able to reduce their usage of potentially harmful NSAIDs, which are non-steroidal anti-inflammatory drugs, think ibuprofen, when using cannabis as an adjunct therapy. In regards to headaches and migraines, Philip Denny, MD, was quoted in the report Migraine Sufferer Finds Relief from Marijuana in 2005 as saying cannabis is one of the best medicines for migraines. And David L. Beeman, a physician and medical marijuana expert, said in a letter printed to the Los Angeles City Beat in 2005 that not only are there thousands of migraine patients who benefit from cannabis, but it's been cited by such historical medical luminaries as Sir William Osler, who's credited as the father of modern medicine, and Dr. Morris Fishbein as the best treatment for migraines. I'll address, I guess, its alleged addictiveness. Colin Blake Moore, PhD, Leslie Racine, PhD. As my partner said, unlike for nicotine, alcohol, and hard drugs, there's no clearly defined withdrawal syndromes, the hallmark of true addiction, when use is stopped. And the Institute of Medicine published in its March 1999 report, Marijuana and Medicine, assessing the science base, some controlled substance that are approved medications produce dependence after long-term use. This, however, is a normal part of patient management and does not generally present undue risk to the patient. Another way of putting that is there are plenty of people who are on pharmaceuticals which have much more damaging effects, such as opiates, which are definitely way more habit-forming, and people still take them because they have to. And I actually have a couple of rankings here of addictiveness. In a study titled "Is Nicotine Addictive? It Depends on Whose Criteria You Use," Jack E. Henningfield, PhD, and Neil L. Binowitz, MD, both compiled a list of the six most common abuse substances: heroin, alcohol, cocaine, nicotine, marijuana, and caffeine, and both of them listed marijuana last on the list. And when it comes to memory and learning, it's actually been found to be quite beneficial in the treatment for Alzheimer's. Lisa M. Eubanks, PhD and staff scientist at the Scripps Research Institute and the Skaggs Institute for Chemical Biology, said in August 9th of 2006, in the study A Molecular Link Between the Active Component of Marijuana and Alzheimer's Disease Pathology, THC is a considerably more effective inhibitor than the improved drugs for Alzheimer's disease treatment, donesipril and ticrine, which reduce protein deposits in the brain by only 22% and 7% respectively, at twice the concentration used in our studies. THC and its analogs may provide an improved therapeutic for Alzheimer's disease by simultaneously treating symptoms and progression. It actually has been shown to slow the, neurodegenerative effects of Alzheimer's. And our opponents brought up, driving accidents. My partner already stated that there have been no fatalities as a result of the consumption of medical marijuana, or marijuana in general. Any driving fatalities where marijuana may have been implicated? they were on something else, not just marijuana. It had to have been cocaine or alcohol. All of these studies, if you double check them, you'll find that they had other stuff in their system. Marijuana provides little to no car handling impairment and consistently less than alcohol in many legal medications. Consistently less than alcohol in many legal medications. According to the Center on Addiction and Substance Abuse in Legalization, and yes, for glaucoma, studies dating back to the 70s found that it was effective in treating glaucoma. According to a article in a 2002 issue of Time magazine, Is Pot Good For You? Marijuana does reduce pressure on the eyeball about 25%. And I will address both asthma and the effects of smoking in regards to lung cancer simultaneously, as there are more ways of consuming marijuana than just smoking. You can also vaporize it. It vaporizes at a temperature of around 375 degrees. So you're basically just inhaling water vapor. Or you can cook it in food. According to Daniel Giomelli, PhD professor of pharmacology at UC Irvine, 2007, we think that by targeting cannabinoid receptors in the upper airways, we can control coughs in a number of conditions. Marijuana smoke causes bronchodilation, as opposed to tobacco smoke, which causes bronchoconstriction. It also causes vasodilation. That is to say that it opens your airways and your blood vessels. So it reduces your blood pressure and makes it a lot easier to breathe. And a 2008 study suggested that smoking marijuana and tobacco have a lower risk of cancer than those who only smoke tobacco. That's because many studies have found that THC actually has anti-carcinogenic effects. That is to say that it prevents the formation of tumorous cancer cells.